Many people are aware of the terms unconscious bias and microaggressions. It is important to understand both, as our unconscious biases can lead to language or behaviors that are experienced as microaggressions by others. Microaggression, as you can see here, is a term that was actually coined in the 1970s by Dr. Chester Pierce. And he did this to distinguish the everyday verbal and nonverbal slights or snubs which are experienced by marginalized groups compared to a macroaggression such as an assault. In the past decade, the term has become more and more commonplace with the work of Dr. Daryl Wing Su and his colleagues, who have really brought this into the common lexicon. There are multiple forms of microaggressions, and there are multiple levels of them, so it is important to become aware of that spectrum. It is also important for educators and clinicians to be aware of microaggressions, as they may personally be impacted by them. They may unintentionally be an offender, and their words or actions may be microaggressions towards others. And our learners and colleagues may very well experience microaggressions in the clinical and educational settings and require us to support them and understand them in these times. There are two crucial points to know as well. While a microaggression may be unintentional, it is not just the intent, but it's how it is experienced by the person receiving it that is most important. In addition, these microaggressions can have a great impact on somebody because they happen every day, they happen often multiple times a day, and they are a constant experience in the daily lives of some people. Therefore, it can really impact people in multiple ways, including their mental health.
Microaggressions' impact on clinical care. Decades of research clearly documents the existence and persistence of health and healthcare disparities impacting minority and other marginalized populations. Way back in 2003, the IOM report Unequal Treatment specifically called out provider bias as a cause of healthcare disparities. Microaggressions that result from unconscious bias and stereotypes directly impact clinical care because our patients, and sometimes even our colleagues and learners, are the target. When we, as health professionals, communicate hostile, derogatory, or negative messages to our patients, especially those from marginalized groups, the likelihood of those patients having a positive experience and good outcomes is diminished. In addition to impacting patient trust, patient satisfaction, and probably, quite frankly, even access to care, research has shown that microaggressions can lead to elevated levels of depression, trauma, heart disease, and diabetes.
In addition to impacting our patients and care team members, our learners are also greatly impacted by the episodes of these microaggressions. We know that about 60% of medical students or residents, when surveyed, will report being impacted by microaggressions in the clinical learning environment. Those rates jump up much higher when you survey women or those that are underrepresented in medicine or otherwise marginalized. The impact is, of course, cumulative as it is for everyone, but leads to increased rates of mental health issues, including increased rates of positive depression screens in our medical students, increased rates of anxiety, and overall decreases in well-being. It leads to a worsening in academic performance and cognitive function, as students are so busy processing these episodes of discrimination and bias that they cannot necessarily focus on their medical knowledge, patient care, and clinical reasoning skills. It perpetuates stereotype threat and imposter syndrome. And together, the cumulative effect of all of these problems is that we have increased rates of burnout, job dissatisfaction, and lower rates of success and retention for our learners in the medical community. For these reasons, it's of the utmost importance that all educators that are invested in the success and well-being of their students be knowledgeable about microaggressions, are able to identify them, and also have a plan in place to mitigate their effects.